Wikidata.com.
Last month we had a patient coming to our clinic with a lot of teeth which are lost, especially on one side. She was wearing a denture on one side which was removable, and she was having a lot of problems. So we made her comfortable in the chair. We had a look at her teeth, and we started telling the problems and things like that. And there was some problems with her upper teeth, and there were some teeth which are lost even in the upper, which she was not bothered. She never kept a removable denture. She wanted one side of the teeth to be, one side of the mouth to be corrected, because she had lost some teeth. Now, while I was just preparing her and getting her ready, I was talking to her, and then I told her these are the problems and these are the problem list if you don't keep the teeth in the upper and things like that. So I had somebody who was listening earnestly to the whole conversation. That was her own sister who was standing nearby, and she was hearing all these discussions. Now, after I was consulting this patient, and then told how much time does take and how many times she'll have to come. She was coming around 300 to 400 kilometers from my place. So then they started talking to each other, and then she told, even I have that problem. So then she also had lost some of the teeth in the back, and then she also has started to lose on the other side also. So they were two sisters, and she had the same problem. So two things I would like to point out from this, because when these are areas wherein you have problems on one patient who is living in another house, but they are related to each other. So when they are related to each other, what happens is there are chances of getting the problem for her also. They are separated by 3 years or something like that, but she had lost the teeth, the other person also had lost the teeth. So when I consulted one patient, I got the privilege of getting the other patient also on my chair, and then we had a look at it. Now, she had a little more lesser advanced case because she was younger to this patient. So what happened is her problems were not as advanced as the other person, but she also had the same problem. So I was telling her, in 3 years or 4 years time, you will reach the same position as your teeth. So as a subscriber or as a listener to my show, I'd like to tell you, if you have a problem, especially please tell your sister, your brother about your problem, so that they will also identify, and tell your brother to go and visit the dentist. When you go and visit the dentist and get into a trouble, then you should always tell brother and sister to go and have a look at the dentist, because they might also have inherited problem. It may not be a inherited problem, it is also because of your likings. Like, see, it may not be an inherited problem, or you might also have the same brother or sister having the same likings. Like, if you like ice creams, or you like food with that are fibrous, it might get into their gums, even in your gums. So your likings also or your habits also make your teeth. So all these things are areas wherein you can inherit a problem. So whenever you have a problem, you always tell your siblings also. Your siblings will also might have the same problem. So or when you hear that your sister or a brother has had to go for a larger procedure, like loss of teeth or gum problems and things like that, please make sure that you also go and have a checkup, so that you will not get into that trouble which your sister or brother has already gone for. So you might be able to save the teeth much more earlier. So hereditary areas of your or hereditary inherited teeth problems can be solved with all these things. So it's an insight you can actually get. So what happened during this time is, actually we prepared her teeth, and we started preparing her upper teeth for replacing her lost upper teeth and space closure and things like that. As soon as the other sister also saw that her sister is getting looking good after the treatment, she also engaged into our clinic, and we got her teeth also corrected. So both the sisters are happy, and they are coming together nowadays for follow up. So so all these things can be possible if you can have See, just because she was listening to her, if she had not come along with her sister to see this one, she would not have recognized her own problems. So, what I will suggest you is always tell your siblings about your dental problems, so that if at all they can save their teeth, if they at all they can save their teeth much before your problem starts in their own mouth, it will be much more easier. So, there are hereditary issues also, or even hereditary likings that can cause dental problems. So, all these things will help you. So, please make sure that you subscribe my channel and understand more about dentistry and how to keep your teeth and how to save your teeth from problems. Please subscribe this Wikidontist channel. Thank you very much. I am Dr. Thomas Nechipadam from Nechipadam Dental.
Wikidentist.com